Years into the pandemic, the state is still reporting thousands of positive COVID-19 cases each week. Chances are by now you've either been diagnosed with the virus or know someone who has, some even multiple times. Our 6 News reporter Luke Snyder was at Henry Ford Hospital today. He's here for you now with what health officials are seeing.
Doctors here at Henry Ford Allegiance Health say despite being nearly 2.5 years into the pandemic, COVID-19 hospitalizations remain steady, with patients with the virus filling up around 10% of hospital beds.
It is discouraging, right? We'd want to see that, that we're not still at those levels at this point.
Dr. Cortland Katayan's been fighting COVID-19 on the front line since the very beginning. He says they've recently seen 20 and sometimes 30 people hospitalized at one time, with a few on ventilators. The majority of those people have other medical conditions.
We're losing somebody usually every week. So 1 or 2 people a week typically are dying of COVID in Jackson County.
Case numbers are not where they were earlier this year, but experts say new subvariants of Omicron, like BA.5, are causing deeper lung issues.
It's very, very easy to get, and you also see immune breakthrough. So that means people that have been vaccinated or who have had a COVID already are still getting BA.5 because it's so good at infecting people.
But Dr. Katayan says this doesn't mean the vaccines are not doing their jobs.
The vaccines have been and continue to be excellent at preventing people from getting very sick.
Experts say plans are in place for an updated vaccine that will treat new variants. Dr. Katayan expects it to come out around October.
So now you're going to have basically protection against the original COVID virus, but then also these new variants.
The hospital says they'll continue to adapt to whatever the need is, and that includes the potential of an increase in cases this fall.
It's just an expectation we have now in healthcare that we need to be in the hospital ready to accommodate surges that happen in COVID, and we have to flex our operations accordingly.
Here for you in Jackson, Luke Snyder, 6 News.
State health officials are expanding